Hello to everyone and welcome to the ISQua and IHI debate on the challenges of our increasingly ageing population worldwide. We have 4 leading experts across different countries in the world who will be debating our motion, and we'll be hearing about how some of the countries are trying to address what is becoming an increasing global challenge for all the countries around the world. So the debate is titled, "By 2030, institutional care for older people will be unaffordable, and the absence of alternatives will lead to a crisis in the quality of care for older people." And just by way of setting the scene, by 2050, the number of people in the world over the age of 65 years will equal the number of children under 14. And similarly, the number of people over the age of 50 in the world will grow from around 1.4 billion today to 3.1 billion. So these are challenges that are gradually increasing, sometimes faster in some countries than others, and they are posing discussions and questions that are being triggered around the world. And both ISQua and IHI are involved in trying to help facilitate some of those discussions and sharing the experience to addressing some of these challenges. So the kind of conversations that are happening, that you'll be hearing about in both sides of the debate, are around how we keep people healthier for longer, how we improve the way we integrate care and support from primary care, community care, looking at acute services and home care and long-term care. So how do we provide a much more integrated patient journey so that people can be in more control of their needs and better decisions are made earlier? How we help people improve their own self-care. So how do we as a population take some responsibility with partners in health and social care to improve our own health and well-being, to ensure we live a healthier and longer life? How we better manage long-term conditions with increasing age and with increasing factors elsewhere in the way we live our lives in many countries. We have increasing obesity, increasing coronary heart disease, increasing the risks around diabetes, and of course as we grow older we are more likely to live with these conditions for longer. That impacts on our quality of care, the safety of our care, and also the costs of running health systems. And finally, some of the challenges that you'll hear about in the debate are around the fit-for-purpose nature of our financial strategies for running our health systems and our countries. With increasing ageing population, reduction around childbirth in some countries. That means we have a greater percentage of the population in our older years. And so what does that mean around financial strategies for retirement age, for pensions, for promoting education, for ensuring that we have a more invested population that helps fund our health and social care services? So these will all be discussed and some of the innovative challenges and solutions around different parts of the world you'll be hearing during the debate. So we have 4 superb leaders who are spending their time and sharing their views with you during the debate, and I'm sure it will be fascinating and colourful. Firstly, supporting the motion from ISQua, we have 2 eminent speakers. The first is Rita Amelios. Rita is Senior Medical Officer in the National Supervisory Authority for Welfare of Health in Finland. Rita has specialised in geriatrics since 1991, and she has been a senior lecturer at the University of Tampa and research associate at the University of Wisconsin in the States. Secondly, we have Yuichi Imanaka. Yuichi is Professor of Healthcare Economics and Quality at Kyoto University Graduate School of Medicine, and is also an executive board member of the Japan Council for Quality Healthcare. Yuichi served as a member of the International Hospital Federation and the WHO study group in hospital sector reform. He's also a member of the OECD and WHO Healthcare Quality Improvement Network in the Asia-Pacific region. So you'll hear from Rita and you'll hear from Yuichi to propose the motion, and then you'll hear 2 equally eminent speakers from IHI who will be debating other aspects and the alternatives to the motion. Firstly, you'll hear from Goldman. Don is Chief Medical and Scientific Officer for the Institute for Healthcare Improvement, the IHI. Don's focus is particularly to focus on the ties between the IHI and health service research and academic communities. Don serves as a senior lead for the IHI Fellowship Programme, and he trains and mentors emerging investigators at Harvard Medical School, Boston Children's Hospital, and Harvard School of Public Health. And then the final contributor to the debate is Yitha Block. Jos is founder and CEO of the Buurtzorg in Netherlands, and the Buurtzorg provides home care services to around 60,000 people per year. They have been heralded for their creativity and innovation in the types of services they provide. And Jos, who is a nurse by background, is considered to be a considerable change agent for the organisation and model for home care in the Netherlands. So you'll hear both sides of that debate and some, as I say, very colourful and interesting discussions and viewpoints about some of the solutions and the degree of the challenges that we're facing through those presentations. So after we've heard from our debaters, Paul Bartels, who's a friend of ISQua, has kindly agreed to sum up and conclude the debate. Paul is an MD and he's a specialist in chemical pathology, and he's a director of the Danish Clinical Registries. He's the head of the ISQH, or the European Society for Quality in Healthcare's Office for Quality Indicator Project, and he's a member of the advisory board for the WHO PATH programme. Paul is a lecturer and author of numerous publications known to, I'm sure, many people, and these focus particularly on quality and patient safety. So that's it from me. Please sit back, enjoy the debate, and please contribute and let us hear your views and thoughts during the process of the debate. Thank you very much.